mainly just to build the skills of HIV service providers like yourselves in Texas. And this is done through several key goals that we want to make sure that we reach. One of them being to enhance the capacity of service providers in Texas to provide treatment and services in a culturally responsive way. A second one being to improve sustainability through staff and leadership development, fundraising, evaluating programs, and support the national HIV/AIDS strategy. So we know there's a lot of changes coming along with the national HIV strategy. We want to make sure that service providers in Texas can understand those and incorporate them into the organizations to make sure that they maintain sustainability. And lastly, it's to provide a space for networking. So in a time when resources are becoming more scarce, networking in an area like this and kind of collaborating with other service providers is very beneficial in maximizing our efforts.
The way that this whole idea of regional assessments and training institutes has come about in our capacity building assistance program. So our capacity building assistance program, Hands United or Manos Unidas, has been running since 2005. And over the course of the years, we've held several of these regional assessments and training institutes, the last of which was last year in Philadelphia. And to give you an idea, all of the needs that we have identified in all of these different regions have been very different and have shaped the training institutes, which are very much customized along the lines of the needs assessments, have shaped the training institutes in different ways. So some of our assessment findings from the different regions in the past, and this includes the New York City, Connecticut, Rhode Island, and Puerto Rico training institutes. So we saw some commonalities, some barriers on the programmatic level. So folks who were looking for adequate materials, culturally competent materials, for example, to serve their target populations. On the agency level, so barriers along the lines of adequate staffing and expanding, the need to expand agencies' collaborations. And then we also saw barriers on the external level, so changes in funding levels, changes in the way that HIV services are provided, and we've also, so there are also themes that we've seen throughout all of our past needs assessments, including stigma. So it's always, this is a topic that always comes up. Even 30 years into the epidemic, we do continue to see stigma as something that service providers continually bring up in our needs assessments around training needs as well as barriers that they're experiencing in their work. We also see the theme of staff burnout and the fact that agencies sometimes lack adequate staffing patterns to provide their interventions. And then we see the theme of collaboration, so the need for interagency collaboration as well as collaboration between CBOs and health departments. And as of late, we're also looking at collaborations with non-traditional partners like faith communities, partnering with CBOs, research institutions partnering with CBOs, media outlets partnering with CBOs. So a lot of folks are recognizing the need for these collaborations and the strengthening of these collaborations to happen. We are also seeing a theme of recruitment and retention of participants, which we're going to go into in a minute. So just to give you an idea of some of the cross-cutting themes in our needs assessments, these are all of the needs assessments from between 2005 and 2008. So we see some commonalities. For example, interagency competition keeps coming up. Also, we're seeing the concern, particularly in Puerto Rico, around what happens to clients after the program. That there's this idea that there's this puzzle model. There's this agencies working in different parts of the puzzle, but are not quite coming together because of their experience with silos, working in silos. So how do we overcome that, and how do we provide more holistic services? In Rhode Island, we saw a lot around multiple hats, so agencies looking at how to implement a staffing pattern that is most conducive to providing services, but also is financially sustainable. So these are some of the cross-cutting themes that we've seen. And although we do see a lot of commonalities like stigma and staffing and funding as issues that folks are bringing up during the needs assessments, we're also seeing a lot of differences in how folks are preferring to be trained and what they would like to be trained on. So these are some of the kind of general themes that in which we've implemented the training institutes themselves. And on the next slide here, I'm going to show you the top 5 training requests in each region. Again, this is between 2005 and 2008. So there's, you see a lot of commonalities. You see stigma coming up, social networking, recruitment, cultural competency. And these are issues that have come up once again in our assessment of the needs in Texas, which we're going to go into in a minute. But what is interesting to us is also the customization of these training institutes and how the different needs and barriers that folks are raising as issues during the needs assessment result in very different formats of how we implement the training institutes. So the reason that we are highlighting our change model today is to explain a little bit about how it plays into our work. So this is an example of the training institute that was conducted in Puerto Rico. And we customized it, like I said, based on the needs assessment that we did in the region. So we were able to implement trainings that were directly related to the data that we saw, that we collected during focus groups and surveys and key informant interviews in Puerto Rico. Holistic, so this is the area of our model that deals with the idea that we know that people live in a context, that people live in an environment, and we have to think about target populations in their environment and therefore services in their environment. So in order to provide holistic services, we recognize that organizations need to be very familiar with things like protocol development, evaluation, analysis of target populations, and core competencies. The next area of our change model of capacity building assistance is analytical. So we encourage organizations and all of our clients of our capacity building services to be analytical and reflective of the work that they're doing. So during the Puerto Rico Training Institute, we encourage participants to bring their program protocols and to review them during workshops. We also asked during all of the workshops, not just the ones relating to protocols, for participants to apply this information to their immediate work. So all of our discussions are tailored in such a way that we try to encourage organizations to look at encourage participants to look at their processes, to look at their service provision models, and to think about the content that we're presenting in the context of their own work so that the learning carries forward. The next area is networking. So we recognize that these training institutes are an opportunity for folks to come together in a region, and we always try to create a space for networking and referrals to occur during the training institute itself, whether it's a particular session or it's lunch or it's a less formal activity. But we always, including in the Puerto Rico Training Institute, we've always recognized that this is an opportunity not just for training but also for creating these referral systems. The next area is grassroots. So we do look to community advisory boards for every training institute that we've held, including the one in Texas. We have convened a CAB in order to include the local perspective. We also often utilize local providers as facilitators, as discussants, as we engage them in presenting during plenaries, for example, in order to make sure that what we're doing is very much in sync with the needs of the community and with the realities of service provision in each region. So we have formed a community advisory group in Texas for the current training institutes, and they have been advising us on a number of issues from where to hold them to how to hold them to the schedule to the speakers, and we're very much grateful for their input. And finally, the last part of our change model is evaluatory. So we're always looking to improve our services and to evaluate our work, and we encourage that for the consumers of our capacity building services as well. So we always provide a training evaluation report following the training institute that is based on feedback that is provided to us. So the evaluation survey that I've asked you to complete at the end of our session today is going to become part of the feedback that you provide there is going to become part of our overall report on the Training Institute. And we're also going to be evaluating all of our in-person sessions as well. So following our Training Institutes, each year we conduct interviews to assess the medium and longer term impact of these initiatives. And what we found over the course of the years is that 95% of the people who respond to the follow-up interviews say that a year later they still found the information to be useful. 94% feel that it was effective and are still satisfied with their Training Institute experience. Importantly, about 59% of supervisors report that they encourage their staff to use the new skills that they gained during the Training Institutes, and 46% of participants are continuing the networking that they began during the Training Institute. So again, we are very much committed to evaluating this work, and we're going to be getting in touch with you all to continue to gather this information and hear about your feedback. So I want to pause for just a minute now that we've gone over the background of why and how we conduct these regional needs assessments and training institutes. and ask if anybody has any questions or comments. You can press *7 to unmute your line and ask a question over the phone, or you can ask it over the chat, and Rachel is also soliciting questions or comments over the chat. So if anybody has any questions or any comments right now, please do jump in.
Again, I think it's *6 to unmute the line, or *7 to unmute, and *6 to mute the line. So if you have any questions and would like to speak through the phone line, just press *7.
Okay, so if there are no more questions, we're going to move on, but do feel free to chime in at any time using the chat function.
All right, so what we're going to talk about now is kind of go into detail about the results of the needs assessment we conducted in Texas. So we'll talk about some of the findings that we found through that now. So the way we collected this data, like I mentioned earlier quickly, we reviewed 3 past needs assessment reports. We also reviewed the latest EPI data and reports that was provided by the state and HIV strategic plans. We conducted online surveys through SurveyMonkey, which was distributed for us through DIShes and other contacts, and we collected 115 responses through those. We also attended an all-parts meeting, and we collected notes from those meetings and received feedback about how we might be able to inform the information through that into the Institute. We also conducted 4 key informant interviews, 2 of those being health department staff, and another 2 being service providers. So that's the way in which we've collected the data. And now what we're going to do is talk about some of the findings we've had. So to go into some of the survey respondents, some of the demographic questions that we were able to collect from the surveys, like I mentioned a second ago, we had 115 total respondents through the online survey that was distributed. Some of the key things that we want to point out here is that we do have a fairly even distribution of administrators and frontline staff, so we were able to kind of get a good understanding from both angles there, and a good amount of areas that were served as well. So we have a pretty evenly distributed figure here and representation of what Texas looks like in terms of service providers. So one of the questions that we asked or posed during the survey was about the type of interventions that are implemented in Texas. Some of the key ones that we noticed were at 50 or above 50% of respondents were the providing presentations on HIV 101, another one being peer education, street outreach, CTRS, support groups, food pantry, condom distribution, and CRCS. So those are the ones that where respondents, 50% of respondents or more said they were implementing at their agency. We're going to go ahead and talk about some of the DEBIS, or the Diffusion of Effective Behavior Interventions, that are implemented in Texas. For those of you that aren't familiar with the DEBIS are distributed by the CDC as interventions that are prepackaged and provided to service providers to implement in their communities. So they're pretty much thought of as intervention in a box. So you get an intervention in a box for certain types of populations, and are given funds to implement these in your areas. The top 5 DEBIS that were reported to be implemented in Texas were Many Men, Many Voices, which is a group-level intervention for African American MSM. The second one being Project START, which is an individual level intervention for people that are being released from correctional facilities. Voices is a group level single session of video that is shown to people that are showing up for testing, that are targeted to African American, Latino men and women. The fourth one being Community Promise, which is a community-level intervention that creates role model stories and distributed to the community in hopes of impacting change or influencing behaviors. And the last one being Respect, which is an individual-level, client-focused HIV prevention counseling mechanism.
So one of the things that we noticed when we got this feedback in the surveys is that we saw that there's a diverse mix of interventions that folks are implementing in Texas. So between the interventions that were listed on the previous slide, sorry about that. So between the interventions that are listed here, so some of these are again prepackaged public health strategies like counseling, testing, and referral, and CRCS, and then some of them are more holistic, grassroots type of interventions that are done on the community level, such as HIV 101 presentations and condom distribution, and a lot of these support services that are very much needed in the community, like food pantry and support groups. And then, in addition, folks are implementing these DEBIS that Tony has discussed. So there's a good mix of interventions that HIV providers are implementing throughout Texas.
Right. So along with these interventions that are being implemented, we also notice there's a high level of involvement around awareness days. It seems that this is a big, huge mechanism that is being utilized in Texas in ways to promote HIV awareness. So here you have a list of the different awareness days that are being implemented throughout the state and their level of involvement based on the respondents from different agencies. This next slide here has to do with the topics in which respondents would like to receive training. As you can see, it was pretty. There's a pretty general consensus across the board that people are interested in all these different topics. So we were able to encompass or include this in the Training Institute and the way in which we designed it.
And we're going to go in and talk about all of these topics separately, topic areas rather separately, because we have a lot more data to share with you. So on the topic of organizational infrastructure and program sustainability, we had several different topics that were the most selected. So we gave respondents to the survey an option of selecting from 17 topics, and here are the top 5 that respondents are interested in receiving training on. The most commonly selected one was enhancing staff development, then organizational and strategic planning, addressing staff burnout, grant writing, and fundraising. So kind of your bread and butter, your major areas in infrastructure and program sustainability. And to the right of the percentages, so the percentages represent how many respondents selected each of these top 5 topics, and to the right of that are the ranks. So we also asked respondents to rank order their preferences for training topics, and you can see that the most commonly selected topics also were prioritized as the top 5, with the number 1 prioritized topic being grant writing. So what we're going to be doing now is going through the areas of interest in trainings that were expressed through the survey, as well as some of the qualitative data that we gathered. And then we're going to show you the composition of the Training Institute that we have designed to be along 4 tracks, and you'll see that a lot of these topics fall into multiple tracks.
Okay. And we have a quick question. How did we distribute the surveys? We distributed the surveys through an online mechanism, SurveyMonkey, and the link to this survey was distributed by DISHES, as well as some of our internal contacts as well.
Great. So the topics that were selected by folks in the area of organizational infrastructure and program sustainability fell into 4 areas. So we did a factor analysis of the topics, the 17 topics that were listed, and the factor analysis showed that in this area there were 4 kind of themes that that the training preferences distributed into. One being broad agency operations, so like grant writing, board development, strategic planning, these sorts of broad agency issues. Then there was program level infrastructure such as protocols and program integration, so referrals among programs, for example. The next area that it fell into was staffing concerns, so around staff development, staff burnout, and the last was homegrown interventions, so how to package and develop your own intervention into something that is replicable and that is funded on a sustainable level. And we also asked our survey respondents about why these infrastructure topics were listed by them as priorities. And in their answers, we saw 2 major themes. So there was a theme about kind of change is coming that can't be stopped. So the national aid strategies coming down the pipeline, and all of the resulting funding changes that are occurring due to the national aid strategy, and high impact prevention. So folks are really feeling that there are these changes going on right now, and that are impacting their work. So they're looking to organizational infrastructure to answer to those changes. And in addition, another theme that emerged was that folks are feeling that they need to be meeting the needs of their communities through effective program design. The next area in which we asked for training interests was evidence-based interventions, or basically, in general, intervention programs. And again, there were 17 topics. I don't know why this number 17, but again, there were 17 topics that were listed, and these are the top 5 that were selected by respondents. So you can see stigma, motivational interviewing, HIV prevention and faith communities, behavioral theories, and cultural competency were the top 5 topics that people felt the need for more training. And to the right of those percentages, again, you'll see the rankings that folks assigned to those topics. Again, we performed a factor analysis to determine the areas into which these priorities clustered that were identified by survey respondents. And one area was creating a program. So the process of starting a new intervention program or adapting an intervention program for the target population. So training needs around community mapping as well as adaptation in order to serve the community in the best way possible. Interacting with the client was another area, so group facilitation, recruitment and retention, these sorts of skills around recruiting and and serving the population that is targeted by providers. The next area was community understanding, so folks were concerned about stigma and cultural competency, and other areas in kind of enhancing their ability to communicate with the target population. And finally, some were concerned about receiving training in basic skill sets like the fundamentals of HIV, how to do tracking and referrals. Again, we asked folks to identify why they chose the priorities that they did under the area of programs. And we saw, again, certain themes come up, like the need to serve the population, the need to have the latest information as well as an understanding of the community. So this is kind of an interesting mix for us, because it was kind of the need was identified by survey respondents to think about the latest information, again, these changes that are coming down the pipeline, making sure that they're able to have all of the right skills to target the populations that they serve, and then at the same time, on more of a macro level, seeing the client in his or her environment and understanding the community and understanding certain principles of community mobilization. So there was this sort of dual need under the interventions area. Next, we asked folks about public health strategies. So the one that was most commonly selected that folks would like training on is social networking. Folks also wanted to receive training on linking HIV-negative persons to prevention, CRCS, CTRS, and partner services. We also asked about 8 topics in the area of monitoring and evaluation, and these are the top 5 that folks selected, quality assurance being the most popular as well as ranked number 1. Folks also wanted to be trained in survey design, data analysis, and evaluation, particularly among supervisors. And all of these monitoring and evaluation topics fell into one priority area. So there is this, unlike the programs and the organizational infrastructure that I was talking about previously, where there were kind of different themes that emerged, the monitoring and evaluation was all kind of part and parcel of the same skill set that respondents were interested in gaining. And when we asked them why they are interested in these monitoring and evaluation topics, there were 2 reasons that people provided, that respondents provided. One was meeting the objectives of their program, so making sure that they're providing quality services, so quality assurance, continuous quality improvement, as well as fidelity to the interventions, so kind of reporting back to funders about their interventions. And then the other one was empowerment, so making sure that not only are the programs responsive to the quality assurance measures that are set by the funder, but also that the community, that the programs are working for the community, as well as empowering the staff. And we felt that this is really an important factor in why folks are interested in learning more about monitoring and evaluation, to increase staff buy-in in their work.
Great. And the last topic we asked respondents about was around community mobilization, and there were 10 topics which we asked respondents to rank and select. The top 5 being leadership development, social marketing, linkage to care, awareness day events, and religious leadership development. So in those 5 topics, there's two areas in which community mobilization was divided. It's understanding the process and then also understanding the product. So, for example, in the process we have setting the local agenda, so pretty much getting the community to be invested on what's important and how we want to implement what we want to do. So developing action plans, developing social marketing campaigns. So how do we develop these messages and how do we distribute them? And also how do we evaluate the work that we're doing in terms of mobilizing our community? The second area being the product, and those being the coalitions that we want to build, the awareness staves that are being implemented, and finally developing leadership amongst the community and also our own. The things that we managed to capture from these responses were respondents wanted to be able to maximize the resources that they had available to them, build relationships with the community, so being able to start building these relationships with key community members and get them invested in the work that we're doing, and through that garnering community support. So in discussing target populations, these were the findings that we had in terms of the target populations that most service providers were targeting, the highest rank being MSM, followed by youth, then transgender. Those being the top three, and here you can see the list and the percentages for the remaining target populations.
So this is very important, thinking about the target populations as we were looking at the data that came in about community mobilization topics. Thinking about community mobilization not in a vacuum, but related to MSM, youth, transgender, women, that are the targets of service providers that are of concern to service providers.
So the last area in terms of the data points that we'd like to bring up with you on the quantitative side is the level and logistics. So we encountered that there was a high level of experience amongst providers in terms of the type of trainings they'd like to receive. Service providers know the basics. They know the basic things that they need to know, but they're looking for something more intermediate and advanced. So in customizing our trainings, we made sure to mirror this in the way we're going to be presenting the information. 70% of the respondents to the survey said they would love to attend, would like to attend. And lastly, concerns for attendance were distance, costs, and which is why we decided to implement institutes in different cities, so we would be able to involve as many service providers as possible, so that rather than them coming to us, we would be trying to come to them in a more local area.
So we do recognize that Texas is very large. That's basically what we're saying here. Finally, we wanted to share a few of the findings of our qualitative needs assessments. Like we said before, we participated in the all-parts meeting back in August. We also had the opportunity to speak with several key informants about this, about the needs and the state of HIV services in Texas. So these are some of the things that came out that are folks' perceptions about what's going on with HIV services and how that might inform the trainings that are needed. One of the things that came out was the need for leadership development among African American MSM. They do represent a considerable part of the epidemic in the state. While that is not evenly distributed, there are certain cities where the epi shows that African American MSM represent a large part of the incidence rate, while in other areas the larger part of the incidence is represented in other communities. But one of the things that came out from the folks that we spoke with is that there's a need to involve African American MSMs on organizations' boards as well as in staff of organizations providing HIV services. And now there is immigration status, so Texas being a border state, definitely that came out that immigration status is a barrier and continues to be a barrier to accessing services. Something like 1/3 of the people living with HIV in Texas are foreign-born, so that's definitely an issue and will continue to be so. Folks also pointed to AIDS social stigma continuing, and this is something that we reviewed earlier. This came out in every single one of our needs assessments, the continuing issue of stigma as a barrier to testing, to services, to treatment, the amount of misinformation still out there in the community about the disease. And then also homophobia, as well as perceived homophobia. So whether or not it's actually a problem in an agency, a lot of community members are perceiving homophobia to be an issue, and therefore is a barrier for them coming to services. And then finally, the need for coalition building or community mobilization. So folks talked about the great potential that community mobilization efforts may have, particularly in mobilizing communities that are rural, that include MSM, African Americans, and women. So this is kind of moving forward. Something that folks were really interested in is more emphasis on coalition building and collaborations and community mobilization. Also, a lot of folks, when talking to us, mentioned the recent changes in the field. So decreases in federal funding, both to health departments, HRSA, et cetera. The move from Ryan White to Medicaid as a third-party payer of choice. So that's going to be having an impact around the country. And again, many of these issues are not isolated to Texas. They're definitely things that we hear again and again throughout the country. But the move from Ryan White to Medicaid and the need for adjusting to the clinic setting and billing issues, et cetera. In recent years, the kind of professionalization of the HIV service workforce and the decreased involvement of people living with HIV/AIDS in organizations, both as staff members, as CAB members, as board members, et cetera, was brought up as an issue. And again, folks thinking about support services like food pantries and transportation and maintaining that holistic approach that is very common, particularly in the rural areas in Texas, in the face of these decreasing funds. So providers are thinking about options that they hadn't considered in the past, such as forming partnerships with clinics or moving toward a clinic setting. So these are some of both the quantitative and the qualitative findings that we heard. And thank you all if you participated in our needs assessment. Thank you very much for your information. And if you haven't and you're hearing this for the first time, we'd love to hear some of your feedback.